In rural communities, philanthropies find not only opportunities to impact rural health, but also opportunities to discover what works, and to find solutions that could be helpful in any kind of community. The Rural Health Philanthropy Partnership provides an opportunity for these philanthropies to learn from each other about how they can do the most good.
Funding rural communities is more fun and it's more difficult. They have significantly fewer resources. They have less opportunity to convene and to network, to know what each other are doing. The ability to work together, meet each other and share ideas, I think is a really important part of the work that we provide, and it's eye-opening. I think the important part about funding rural communities versus urban communities is the health disparities in rural communities are much more obvious.
19% of the population in this country lives in a rural place, but only 7% of the funding actually reaches them when we make our grants in rural places. We work with nonprofits, indeed. We also work with individuals, businesses, school districts, local governments, anyone who has a good idea to bring benefit to a rural place. We want to hear about that idea. We turn those ideas into projects. That does a couple of things. It helps create a huge network of champions, a growing network of people with good ideas, and they see that idea become a project and get a check. And today, 70% of our funding is realized between sort of idea and check in hand in under 30 days.
As a statewide health foundation, we recognize that to improve the health of Kansans, we need to improve the health of those living in rural communities. So for instance, over the last 4 years, we've partnered with rural groups to help understand what's challenging for them. And oftentimes it's the ability to write grants. So we can break down that barrier to help them apply for grants by paying for grant writing services. And in the last 4 years, we've brought $55 million back to Kansas, primarily serving rural communities, both for the short term, but oftentimes creating sustainable revenue streams to help them out. The bottom line is we need to work together to solve complex problems.
Rural communities are often overlooked. They have the smallest population, and when people are looking to figure out where to put their money and where they can get the biggest impact, it's often where the largest populations are. But the rural communities need it the most. They have some of the most persistent health outcome challenges and some very hard barriers to overcome that would not be able to address without some additional support.
We know that rural communities have not traditionally had access to grant funding nationally. And thinking from our perspective in Appalachia, we know that with the downturn in the coal economy and in manufacturing, many of the sources of economic development as well as charitable giving in our communities have gone away. And so it's incredibly important that local and regional foundations are connecting with organizations, learning about needs in communities, and providing funding for the good work that's going on.
Philanthropy, I think, historically does a pretty poor job of funding in rural communities. And so we really need to keep aware of where our funding is going and what's going on in rural communities and how we can help the people and the organizations that are there. Making sure that the rural communities in Missouri have access to the same sorts of services and supports that are available in urban areas is really important. And so we try to do a good job of keeping engaged with our rural communities. We actually have staff called community liaisons that are located in rural communities around the state, and they are essentially our eyes and ears for those communities to keep us plugged into the people and the organizations that are there and what's going on.
We're a strategic grant-making organization, and that's important because the dollars that go out the door today to rural communities are making a real difference. We're looking at funding things that are systemic changes for our rural communities.
It's really important that funders consider them as a special underserved area that will benefit from their help more than others because we're truly filling a gap that no one else can fill. What I'm very excited about is building leadership in rural communities because I think that's the best determinant of the success of that community. And so I'm funding 100 rural health MPH scholarships. So for people that live and work in rural communities, they can participate in an online program. It's a 27-month program that they can apply to, and are fully funded through the entire program.
You know, funding in rural communities is really a lot of fun. I enjoy all of the relationships that I've developed at the foundation. But being able to fund rural individuals and really get to know people, you know, they're from the community, their heart is really in it. There isn't the opportunity to jump from organization to organization. The commitment they have to the health and to their own communities is so engaging, and really being able to provide a little bit of money goes a long way. Those relationships are really why I do this work.